Prostate cancer screening is paramount for the well-being of men. Why? Because prostate cancer is one of the leading cancers in the United States, and we know that if the cancer can be detected within the early phases, the chance of cure are outstanding. The chance of us being able to actually preserve a man's normal function, again, outstanding. To date, that's been very simple. It's been based on a rectal examination as well as a PSA test, which is a simple blood test. But prostate cancer screening has actually evolved to the next level. We're now able to actually identify a good number of prostate cancers with advanced imaging called a multiparametric MRI of the prostate. A multiparametric MRI of the prostate takes a look at three different components. We take a look at the prostate itself and we see if there's any dark lesion within the prostate. Apart from that, we take a look at the shift of water through the prostate. Imagine that water will actually diffuse through a prostate at a given state. But if I take a whole bunch of cells and I pack them together, such as a prostate cancer, the water is going to be held up. And that again is another variable that we take a look at when we do a multiparametric MR. The third component is called a contrast enhancement phase. What that means is that when we inject contrast into a body, the prostate itself will systematically absorb it at a given rate and release it at a given rate. However, prostate cancer cells actually have leaky vessels oftentimes, and therefore the prostate cancer segment will absorb the contrast and release the contrast much faster than the rest of the prostate. So based on these three parameters, a dark area within the prostate, change of water flow through that particular segment, and the uptake and release of contrast, we're able to identify men at increased risk of having prostate cancer, and more importantly, we can now identify where the cancer is located. Why is that important? Because if we can identify where the prostate cancer is located, now specifically targeting and treating the cancer becomes that much easier. Whereas in the past, if a man was diagnosed with prostate cancer, we would simply remove the entire prostate or radiate the entire prostate. We no longer have to do that. Now that we can identify exactly where the prostate cancer is located, we can use very advanced technologies such as HIFU to only target the area of concern. That means if the prostate cancer only has a small area of cancer, there's no reason to remove the entire prostate anymore. There's no reason to actually radiate the entire prostate anymore. All we need to do is just get rid of the cancer plus a nice margin of tissue, and that by itself will render a man cancer-free. Find out what your treatment options are. Call us today.